Okay, thanks for tuning in. We're here. We're going to talk about tummy tucks. We have Sarah here who's interested in a tummy tuck, and thank you for allowing us to shoot this video. Sarah has a 12-year-old girl, 6-year-old boy. Everybody's healthy. She's finished having children. That's an important part of this. She's had a tubal ligation, and so she knows that she's not going to have any other children. She's interested in improving the appearance of her abdomen and restoring what she lost with pregnancy and some time and so forth. When we initially met, we did our exam like we typically do, and when I examine the abdomen, I'm looking at the skin and the fat and the muscle. I want to see what the skin elasticity is like. Where is it redundant? Are there stretch marks and things we want to address? On the fat, I'm really looking at how much and where that fat is located. Is it around the belly button? We're also looking at the muscles. And we say we're looking at the muscles. We're looking at what we call the abdominal wall. The six-pack muscles are rectus muscles that typically run up and down. They serve some very important functions. Mechanically, they allow us to do sit-ups and move our body from side to side. They hold our intestines and some really important things in. When we have a baby that we carry to term, those muscles tend to migrate laterally, and the fascia or the tissue in between those muscles stretches, and that's an irreversible change. That's an important part of a tummy tuck, something we want to address. Tummy tuck is really a series of steps that address all of these different things: the skin, the fat, and the muscle. So we're going to perform an exam, again, looking at those areas: the skin, the fat, and the muscle. When I address the abdomen, I don't just want to address the abdomen, which is the front part of your torso. I want to address the flanks, or the love handles as they're commonly called, and even the lower back. I typically use liposuction as an adjunct, and I like to do that to transition the areas where we haven't actually performed surgery, so it doesn't look strange in any way. It looks proportional, and that the silhouette all the way around is improved. We're looking at a few different things. First, we're just looking at the skin. And so I'm going to pull this down just a little bit to illustrate your C-section scars. And this is a very typical location. Our scar for abdominoplasty actually, in most cases, and in this particular case, will go below the scar for the C-section. So that will not be there when we're all finished. Most of the skin excess is, she works out, she's in good shape. She just has some skin excess, especially here below the belly button. So we'll get rid of all the skin and fat here. And poke your tummy out, would you please? It's hard to do. People instinctively want to hold that in. But I can feel the outside edge of her rectus muscle, and it's displaced laterally. And I can feel the space in it. I can feel the medial edges of that rectus muscle as well by pushing deeply. And I don't want to push too hard, and because it can be tender. But there's also some fat on the sides. We're going to treat that with liposuction. The skin elasticity here is good, and it will snap back. We don't have to remove any skin excess there. And of course, we'll tighten those six-pack muscles, or the rectus abdominis muscles. Has a really dramatic effect. It will flatten the tummy, and we'll also sort of have a corset effect and bring in the waist just a little bit here. A couple of details that I tend to fuss on. I like to reduce the pubic area here just to make that confluent with the lower abdomen so it's smooth and you don't see a pooch there. And then I just fuss with the belly button quite a bit to really, I want to make an innie. I want that scar to be down at the base of the umbilicus so it's not visible.